Do you have signs or symptoms or health issues related to PCOS? Are you wondering what the main cause of PCOS is? My name's Dr. Taranella, and in this video, we're going to look at that question. We're going to look at what some of the driving forces are for these elevated androgen levels or other things like sex hormone binding globulin, genetic and environmental things surrounding PCOS. So if this type of information interests you around hormones, health, nutrition, etc., click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer. The information contained in this video is for informational purposes only. It is not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deepen your understanding of health and treatment success. If you need medical attention, don't delay in seeking that treatment. Okay, let's look at what the main cause of PCOS is. So here we want to look at what is the main cause of PCOS. What are the driving factors or indicators of what's going on and what's driving your PCOS? There are many key indicators, blood indicators, symptoms, etc. of PCOS, but what's causing these lab values to go up or go down and what's underlying the changes that are seen in women with PCOS? First of all, PCOS is a syndrome, polycystic ovarian syndrome, which is characterized by androgenization, which could mean more facial hair, could mean your hair falling out on the top of your head, could mean more acne. Also, there's oftentimes changes in ovulation or menstrual cycles and difficulty with fertility, as well as insulin resistance, weight gain, prediabetes, etc. So all those are characterizations of PCOS, but here we want to look at what is driving those things. What's the underlying cause? So there seems to be two main things going on with this. If we look at kind of the overview, and number one is a decrease in estrogen production, and there's also an increase in androgen production. Now, because PCOS is a syndrome, you may not see both of these variables in extremes in every person with PCOS. So, for instance, you may have high total testosterone, but normal free testosterone, and vice versa. And you may not have super low estrogen. It may just be on the low side of normal. So keep that in mind when you're kind of looking at lab values. And it does depend when you check these numbers in your cycle, whether or not they're going to be high, low, etc. There is a separate video on looking at estrogen levels at different points in your menstrual cycle if you want to check that out. There are both environmental and genetic things driving this decreased estrogen production and higher testosterone. And it's not just testosterone, it's androgens in general. So many times the aromatase enzyme, which is shown here and here, but it does work in other areas as well, it's slowed down in women with PCOS. So what's going on there? And with that decrease in the aromatase activity, then you're going to have a flow more in this direction towards androgens. Same thing here. A blockade here is going to cause this to go this way. It's almost like there's, with the slowdown here, you're creating a vacuum in the opposite direction. So as you can see, testosterone has two main fates. There are other pathways too that are not as common, but these are the main ones, estradiol and DHT. So even the DHT can turn into androstenedione as well, which is also an androgen. So both the DHT and the androstenedione are androgenic. This one is somewhere around 10 times as potent as testosterone, where this one is less potent than testosterone. But overall, just having more of these androgens around are going to increase the binding to androgen receptors, and also with that decrease the estrogen around, because there's a, relatively speaking, only so much of these hormones to go around. So if they're going in this direction, they're not going to be going in this direction. So I wanted to point out too that androstenedione is different than this androstenedione. So they're different molecules, where this one is more androgenic and is a precursor or a downstream metabolite of androstenedione. So in some instances, yes, there seems to be genetic things that are driving this aromatase activity down, causing more androgens to be produced. In addition to that, there also seems to be an increased activity of this 5-alpha reductase enzyme, which then sucks the precursors into more of these androgenic hormones. Another thing, as we said, that's common with PCOS is insulin resistance, and insulin resistance does increase the aromatase activity, but it also increases this 5-alpha reductase enzyme activity as well. So you may have a net balancing out there if you do have insulin resistance, but the genetics may be driving this one to go the androgens to be more predominant here. The other thing with insulin resistance is the higher insulin levels that occur with insulin resistance causes the sex hormone binding globulin to go down. In addition, the low estrogen or low relative estradiol and other estrogens are also going to drive the sex hormone binding globulin down. That means, whatever testosterone, whatever DHT, whatever androstenedione is present, more of that is available to bind to the androgen receptors, which is going to stimulate those androgen receptors and all the effects of that on the skin, in the ovaries, and other parts of the body. So what is the main cause of PCOS? Well, it is both genetic and environmental things that are increasing the androgen production and bioavailability. Is it more genetic? Is it more environmental? I don't think we could say conclusively. I think there's environmental things that can be controlled to help improve the lab values with PCOS and the overall hormone balance. And there's also genetic things that we can use that information to also improve the lab values and overall hormone balance. So the main cause of PCOS appears to be more androgen production and more androgen bioavailability. What's going on with your unique situation with your androgen production and your PCOS may be slightly different. So you have to take all this into the context of what your unique lab values are and what those lab values are telling you about what needs to occur in your body to help those things balance out. All right, so that should give you a better understanding of what the main cause of PCOS is. It may not tell you what's necessarily causing your PCOS, but it should give you a better understanding of the things to look at and things to consider when you have PCOS. If you do have questions about this topic or anything related to PCOS, health in general, drop it in the comment section. I may do a separate video on that topic. Thanks again for watching. We'll see you next time.